So good afternoon, everyone, and welcome to this afternoon's webinar, Courageously Living Through COVID-19 Together, Residents and Families. This webinar is one that OARC and FCO have done in the past, and we are rerunning it this week in honor of Family Council Week. The theme for this year is Inspiring Hope, Resiliency, and Change. And given the unprecedented time in which we're living through COVID-19, we chose to kick off our celebratory week with this important session. Before we get started, we are going to acknowledge the sacred land on which we are working. Our work takes place on traditional Indigenous territories across Ontario. Our head office is located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. The territory is part of the Dish with One Spoon Treaty. It's an agreement between the Anishinaabe, the Haudenosaunee, and allied nations to peaceably share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, Toronto and all of Ontario are home to Indigenous people, and we are grateful to have the opportunity to meet and work on this territory. Good afternoon, everyone. So we now have the minister with us. We had some technical difficulties, but she's here. So, Minister, the Honourable Minister MERRILEE Fullerton, thank you very much for joining us this afternoon to give your opening remarks, and over to you.
Thank you so much. It's really a privilege to be here with you, and it's amazing what technology can do to bring people together. So good afternoon, and thank you all. I know the last few months have required tremendous courage from all of you. And I know a number of years ago, going through the long-term care system with my father, not at a COVID time, and it was challenging even then. So I can only imagine how difficult it has been for all of you. And long-term care has definitely been on the front line, and not only here in Ontario, but around the world. And, it's been an evolving process, understanding how we learn in this kind of environment from the countries that are a little ahead of us, but even they are still collecting information. And so it really is evolving, and the science behind COVID-19, we are still learning about it. So my heart goes out to all of you who've been through this the last few months, and we've been working day and night, 7 days a week, to try and address the issues that have been, many of them, long-standing in long-term care. And I know that your loved ones in long-term care homes with the essential visitors only has posed tremendous hardship for some and for many. And so it's been an incredibly difficult time for all of you. But there is some hope ahead. And as we come out of this and we receive the information and the guidance from the Chief Medical Officer of Health about how we can open up to visitors, I'm extremely glad to hear that we are moving in that direction. And some encouraging signs that our outbreaks are resolving. And yesterday we had 220 resolved outbreaks in our long-term care homes. And still only about 78 out of our 626 homes were still in outbreak. And to give you some context of that, some homes are considered in outbreak when there's even not a single case in the home. It can be just one staff member who's tested positive and is self-isolating at home. And yet there's been devastating outbreaks in a number of homes. And you all recognize and are aware, no doubt, that we've had to call in rapid deployment teams from hospitals, the Canadian Armed Forces, and using every tool that we possibly had to support our residents and staff. And so our green homes are improving. Our numbers are improving. We're up to 570 homes in green now. That's about 90%. And also our high-risk red homes, they've gone down by about half, down to about 18. So these are numbers, but I always say it really is the heart for our seniors and our loved ones and our most vulnerable people. They're in our long-term care homes. Our homes are the hearts of our communities, and it's where we rally around to support our loved ones and our staff. And I know that you're all eager to get the support that your loved ones need to them, and we're looking to do what we can to facilitate that as well. So you know that all of our long-term care homes have been tested. Outside of our ministry, to the Ministry of Seniors and Accessibility, retirement homes are now being tested, but long-term care homes have already been tested, and now a second round of testing is underway. One of the difficulties with this virus has been the asymptomatic spread, or the spread with no symptoms. And although it's not always a large percentage that present that way, all it takes is one. And so our active screening very early on was not 100% effective because of the asymptomatic spread. And that's why the testing that's ongoing is so important to continue. And as visitors start to come in, we also have to understand how we can help support our homes and make sure that they stay safe. The ones that are in outbreak, as I said, are receiving care, but the ones that are not in outbreak, we want to make sure that they stay that way. So this work has truly been unprecedented, and I want to thank all of you who have done your part to help your family members to be part of the family councils, and all the residents' councils' input as well. I think it is so important that as anyone in medicine, like I was for almost 30 years, you recognize how important it is to hear people. People matter. They need to be heard, and they also need to be needed. And so I say that from my family doctor's hat, knowing that as a politician, it's a little more complicated, but those same values must not change. And we must care about each other. That is the foundation of a civilized society. And I know that that's what you're bringing every day, and I appreciate that so much. So in terms of our Ministry of Long-Term Care, we were a new ministry as of last summer, and we hit the ground running, looking at our workforce. There was already a staffing crisis, and we set to work very quickly, well before COVID, addressing that. We have a staffing study to inform a comprehensive staffing strategy, and that was launched in February, and that work is ongoing. We've heard from the sector very clearly about the issues surrounding the staffing crisis, and when COVID hit, it took that to a whole new level, and so hence the rapid teams from the hospitals, the military, and all that important work will be ongoing. We also heard from the Justice Police, the public inquiry. That was the report came out in the summer of 2019, very much right after we became a new ministry. And we began to work on that as well, understanding the importance of staffing ratios, the importance of how that impacts patient care, predominantly, but also co-workers. So this is something that is all tied together, and we need to understand how that can be integrated better. And also our government was, very, very proactive in understanding the dollars that would be needed to build new capacity that had not been addressed for many, many years. $1.75 billion to build new capacity and to also redevelop our older homes to modern standards. And what COVID has shown us is our homes at 99% capacity, and also with older wardrooms. Some of these homes would have been decades old, built in the 1970s in some cases, and not redeveloped. And that, close contact creates risks. And so we're very, very aware of that and the importance to redevelop our homes. And we have about 8,000 beds, spaces that will be able to become online for construction within the next year. So it's going to take some time, but we're actively looking at ways we can support more people in the community as well, understanding that as time goes on, that will be also a critical piece to supporting an aging population. And so these are all pieces that are so important to protecting our loved ones and ensuring that long-term care homes are places to live. And I went through the healthcare system, like I said, for decades, and long-term care must not be an afterthought. We must integrate it with the expertise that's in acute care so that we have more of a continuum of care, so that people are not falling through the gaps and that they're getting the care that they need. And that's going to be absolutely critical as our population ages, because we've only just begun to age as a society. So COVID has taught us many, many lessons, things that we not only knew beforehand, but were laid bare by the devastation of COVID. But also the importance of community and how we all come together to help one another in a time of need. And so I'm so grateful for everyone, all the different pieces that have come together to provide that support. But clearly, we need to address the importance of long-term care as an integrated piece of our healthcare system and our social support system. It's absolutely critical that we do that. So over the lessons learned, not only about personal protective equipment, which was shortage around the world, and our procurement strategies for that, not only provincially but federally, and understanding the lessons learned from SARS, really needed to be reinforced, that we need those supplies and they need to be maintained. Absolutely critical. And that, as I said, our Canadian Armed Forces came to our rescue in our time of need, but they also served Quebec to a large degree as well. So Ontario was not alone in this tragedy, but we must learn from it. And I also want to touch on inspections a little bit, because there's been a lot said in the media about inspections, 9 inspections of RQIs. You might have heard those terms. And I want to correct the record so that you have accurate information that over almost 3,000 inspections were done in our homes, and many inspections of a variety of kinds, including public health, doing kitchen inspections and food inspections, mandatory 3 times a year. And the transition from inspections called RQIs in 2016, as recommended by the Auditor General's report in 2015. And so that's what you're hearing when you hear about, sometimes you hear the media say that there were only 9 inspections done. They're referring to the RQIs, which were being phased out and exchanged for a high-risk inspection process that cleared an inspection backlog of about 8,000 inspections. So the previous inspection RQI system just wasn't working, and the previous government embarked on a new process after a report by the Auditor General. And so now we do have our long-term care inspectors in constant contact with our long-term care homes to coordinate those supports that are needed, whatever that might be. And rigorous inspections are underway as we speak in our highest risk homes. So we're acting fast also to launch an independent, transparent, and public commission. There will be public input. There will be public hearings. There will be a public report. And so we must put measures in place to make sure that we take every bit of information that we possibly can to understand how to prevent this from happening in the future. You may have heard of a second wave concern, and certainly that's on the top of our minds as well. So I just want you to know that we are taking measure after measure to address this issue, and it has been devastating, but we have to continue working to persist to solve these challenges and keep our residents and our staff in long-term care homes safe. And in terms of the essential visitors only that I touched on before, recognizing again that it was a tremendous hardship for families, but it was a critical and necessary decision that we made with difficulty, because we knew the challenges that it would pose to families and our residents and staff. So this is an unprecedented time, and I am so grateful for all you do as family members, to be there to support your loved ones, to support our homes. And, you know, we are all in this together. So thank you so much for your invitation to speak today. Appreciate it very, very much. And we'll get through this. Thank you.
Thank you very much, Minister, for attending and bringing your greetings. And we look forward to everything that you've spoken about, the public commission, the future of staffing, and so on in long-term care. And we'll be there with you to provide that important family input and ensure that, that we're working together to create the best possible long-term care system. So thank you very much for your time and your patience with our technical issues. And we wish you all of the best in your work, and we'll be there with you to help you with that.
Thank you so much, and please keep up your good work. I look forward to our next meeting.
Thank you very much. Take care. Well, everyone, thank you for this. Now, I've been paying attention to the chat box, the questions that have come up. Those are things around the future of long-term care, around, exploring inspections and so on. And we will continue to bring this to the attention of the government. But now we're going to get into this afternoon's session, the content. First, we are going to explain who we are. We're going to explain how these are unprecedented times, and so our hope for this time together is to provide a forum for safe exchange of information, opinion, and emotion. As I've said, I'm Samantha Peck. I'm the Executive Director for Family Councils Ontario. With me is my colleague, Dee Lender, the Executive Director of the Ontario Association of Residence Councils. She'll introduce herself in just a moment. Before we get started, we're going to help facilitate information and so on this afternoon, but we're not social workers or counselors, but we do believe that coming together, seeking solutions, and working together for the common benefit will create excellent experiences for residents and families. So now I'm going to invite my, my wonderful co-presenter, Dee Lender, to introduce herself.
Hi, everybody. Thank you very much, Sam. We are so glad that you're with us today. We look forward to our time together. We may not have all the answers, but we appreciate the dialogue, and we absolutely appreciate the concern, the questions, and some of your questions that I'm noting in the chat box. There's tremendous overlap between Residence Council and Family Council common interest. So rest assured that we are working together when relevant and effective, and in parallel when the issues are a little different. But both Family Councils Ontario and OARC, the Ontario Association of Residence Councils, is deeply committed, deeply engaged, and deeply involved in whatever we can do to better the living and the working and the visiting in long-term care homes. So let's begin.
Great. So we've told you a little bit about who we are, but we're going to go into more detail about FCO and OARC. We'll candidly discuss the unprecedented time, acknowledge how the crisis has affected our lives, reshaped them. We're going to look at how we've risen to the challenge with grace and courage, and harness the really important collaborative relationships that we have to find solutions and support. We'll do a brief Q&A, and then what we're going to be doing at the end is doing some small group discussions so that you can connect more closely with your peers and explore how to apply what you're learning here. So this is the third time that we have, this is the third time we've done this presentation together. So we know it's not the one and only time we'll be pulled together for this type of purpose, for this support, because we do need each other. We need to find support and encouragement together and have safe places to voice concerns, worries, celebrations, and fears. So this is that place. And together, we will inspire hope, resiliency, and change. FCO is an organization that leads and supports families in improving quality of life in long-term care. So our mandate is to advance the effectiveness of family councils across the province, but we also work to help families better understand the sector and to be able to engage in it. And so we do that by working collaboratively with our partners to cultivate effective family councils, to advance public policy and system change, which is part of the work that we do with the ministry and other stakeholders. And we do a lot around mobilizing knowledge exchange. So taking information from our sector partners and being able to connect that to the lived family experience and to inform family council work and the support provided by home staff. We're a charitable not-for-profit, and we are funded by the Ontario Ministry of Long-Term Care. Our services, we do a lot of just talking to people. So consulting with family members and home staff, lots of education and training on how to create and maintain effective councils. And right now, we are doing a lot to help families through the COVID-19 experience and to work with the sector to embed the lived experiences, thoughts, and opinions of families into responses to the crisis. Because what we want is effective councils that have strong collaborative relationships with the home staff to work on culture change that creates vibrant places to live, work, and visit, and to ensure that that family voice is embedded in the long-term care system and all decisions that are made. And we do that work a lot in partnership with organizations like OARC.
Thank you, Sam. So similarly, OARC, the Ontario Association of Residents Councils, is a not-for-profit organization. We're very tiny. We are funded by the Ministry of Long-Term Care and a very small amount through a membership-based portfolio. Our mission is to empower long-term care residents to understand their rights, share their lived experience, and inspire a better tomorrow. We do that in many ways. We are all about education that supports the effective and sustainable resident councils in every long-term care, but also, more poignantly, since COVID has hit us, education to the community, the long-term care community, and the broader community, specifically around issues that residents are facing while living in long-term care. We are a venue for the collective voice of residents living in long-term care homes. And, excuse me, and we do provide, as Family Councils of Ontario does, advice on policy, regulatory development, and we consider ourselves part of the positive culture change that is happening in long-term care. Next slide, please. Our board of directors is unique. Our governing body is made up of resident leaders in long-term care homes. So every board member is a leader of their residence council in their home. So this gives you a snapshot of our current board of directors. We have people from Newmarket, Oshawa, Sudbury, Windsor, Mississauga, Keswick, Toronto, Ottawa, Willowdale, Burlington, etc. And again, each of these people are leaders in their residence council. We have a gentleman as young as 47, and she's not on here right now, but last year we had the privilege of working with a board member who is 99. And she just celebrated her 100th birthday, and she figured that she was a little bit too old to be involved in such vigorous, rigorous work, so we said goodbye to her last year. We are living in an unprecedented time, as the minister said. Living and working has changed in long-term care. Having a loved one in long-term care is now not the same experience as it was just a few years ago. Residents are older, living with many more comorbid health challenges. 70 to 80% of residents are living with cognitive changes that leave them unable to speak for themselves. There are many more younger people living in long-term care homes now too. Prior to COVID-19, we were struggling with significant human resource shortages. For years and years, Dr. Bill Thomas, the creator of the Eden Alternative, has said that the 3 plagues we seek to rid our residents of in long-term care living are loneliness, isolation, and depression. And this was pre-COVID-19. Then COVID-19 hit, and we are living with a new world. Ambiguity and uncertainty. How long are these precautions and directives going to be in place? Homes closed to visitors, activities changed, the whole heart and soul, the rhythm, the lifestyle, the care team, of which family members are a vital, integral part. All of that changed. Large whole home celebratory programs and the smaller, more intimate gatherings, they have virtually come to a stop. And now we're 3 months in, which has brought a whole new set of concerns. I remember months ago when my friend texted me that COVID-19 was in the very first long-term care home, and I thought, oh boy, here we go. Sam and I, several weeks ago, a couple of months ago, in fact, had a call with the ministry when they were contemplating the impact of the restrictions on visiting. And while we were in support of this restriction for infection control purposes, we were and remain deeply moved and saddened by the incredible impact that this directive has had on the emotional and psychosocial well-being of residents and most definitely of you, the family members. Next slide. Great.
So this webinar is called Courageously Living. And this is intentional because the definition of courage is the ability to do something that frightens oneself or strength in the face of pain or grief. So we knew that long-term care has been challenged for many years, and that living, working, and supporting people in long-term care took creativity, patience, love, and understanding. But we didn't know it would take courage, at least not courage to the degree we've had to muster over the past many weeks. So we, though, continue to live and work courageously through this crisis. We're seeing examples of courageous living from residents, family members, home staff team members, government who is taking a leadership role in making decisions. And so there has become a new normal. And this normal changes as quickly as the pandemic unfolds. As government passes new directives, media stories develop, numbers continue to change, increase, unfold. And in the long-term care sector, we are striving to protect the lives of residents, family members, and home staff teams. So the reshaping of our lives that we've had to understand and adjust to are things such as the visitor restriction, the emergency orders around increasing HR capacity, the restriction on discharging residents during the pandemic, the essential need for open, honest, transparent communication, and testing. So we're going to talk about these issues right now. Over to you, Dee.
Yeah, thanks. I forgot to unmute. So the first thing that we encountered was the restriction on long-term care home visitors. The definition of an essential visitor was declared as those people, those visitors, who are visiting a resident who is gravely ill or dying, or those performing an essential service. As previously mentioned, we were acutely and are acutely aware of the cost, especially as time marches on the psychosocial and emotional health of residents and families, and also the practical, the logistical rhythm that you are part of their care team. The in addition to recognizing that COVID-19 is a virus that is communicable from person to person, and it's a new virus we know very little about, the decision was made that to keep residents safe, visiting needed to stop. The only way that we have to provide safe, facilitated communication between residents and their family members is seizing the opportunity to engage with technology. So we have a virtual toolkit that was created several weeks ago now with OARC, FCO, and a fabulous group called Tech Coaches. We work together to create a toolkit for long-term care homes and for retirement homes that may need some guidance and instruction. And Sam's going to mention this now.
Yeah, so as Dee mentioned, the visitor restriction has had severe consequences on people being able to stay in touch. So we know that virtual visits aren't necessarily the right solution for every resident or family, but we were hearing from people who were saying, you know, we want to figure out how to use iPads and smartphones to do Zoom calls or Skype visits. So how do we do this? So there was a need, and together in partnership, we developed a toolkit to help long-term care and other seniors communities use technology to set up video calls between residents and loved ones. So this toolkit, if you haven't already checked it out, I encourage you to do so. Even in your personal life, connecting with your friends or family, this may help you that way as well, because it helps you walk through how do these tools work? So how does FaceTime work? How does Zoom work? So you got those technical skills. But also for implementing such a program in long-term care, it'll help you to explore best practices around using technology, around sanitizing devices, and so on. So this is one way that we responded to the need that's out there. So we're going to just get a little bit of information from you. So say, has your home used virtual visits to help residents and their families stay in touch? So let us know. All right, it looks like many of you have. So that is fantastic. Of the 44% of you who have voted, that you were able to, that you are using, 100% of those people said they have used virtual visits. And just looking through the chat box, what I'm seeing is that many of you have, but we're also recognizing that it's not the right solution for everyone. So someone, Diane, is saying that the team in charge of activities are busy with FaceTime. There are not necessarily a lot of sufficient numbers to really allow that to happen widely. But the home has looked at redistributing staff from canceled activities to doing Zoom calls and so on. But it did mean that there was a trade-off between that and other activities. Christy's saying, yeah, virtual visits aren't easy with someone who has Alzheimer's, and that's true. So that's why part of what FCO and OARC have been doing throughout the pandemic is connecting with government and other stakeholders to explore what are other solutions. How do we enable safe window visits and looking at safely reopening homes to families again? So that is great. So for those of you who've used it, that is very good to hear. And now, Dee, back over to you to talk about some of the HR issues.
Thank you, Sam. So the emergency order that we're speaking of was issued on March 23rd. It was first in hospitals and then a week or two later in long-term care and then into retirement homes. In speaking with the ministry on this, I was told that the ministry is in fact catching up to the reality that is happening in homes. So recognizing the reality, the stark reality, there needed to be a directive to support the homes that needed to forge forward in the crisis. The overarching principle is that the legislation was relaxed in order to meet a variety of needs that homes were facing, recognizing that homes all across the province are struggling in varied areas. So it wasn't a one-size-fits-all approach. The relaxed legislation was put into place to provide a larger human resource pool, created more flexibility, created the flexibility to draw on people who, in the opinion of the licensee, the administrator, had relevant skill sets that could be applied. So for example, what we're talking about is non-clinical. So let's say there was a cook at a local restaurant. That cook could be a valued addition to the long-term care home kitchen, even though they may not technically have the prescribed credentials that the Long-Term Care Home Act shows. They could have the skill set that is relevant. Another example may be someone who is an educational assistant who has the skills of working with people who have special needs. They may very well have skills applicable and appropriate to be an effective PSW in a long-term care home setting. So the administrator has the flexibility to draw on a wider pool of people. It's not intended to fill clinical or registered professional positions, so it's not as though a vacancy in a nursing role could be filled by someone who does not have those registered skills. The legislation was also changed so that redeployment of staff members throughout the home was made possible. So truly an all hands on deck approach. And the other part was a change in the volunteers, the use of volunteers to perform work if the volunteer is providing an essential service. So for example, trained in assisting residents with meals. Other pieces of the relaxed legislation included a decrease in the documentation requirements and reporting requirements so that the more secondary or administrative reporting was not essential. Critical incidents that are required in terms of being reported to the director, they are required, but other regulatory required items are not. Care conferences, physical examinations, other secondary types of meetings are not required. And I just want to reiterate that anything that has direct consequence and impact on resident care and safety is absolutely still required. But all of the other types of documentation, meetings, support that is listed in the Long-Term Care Homes Act that does not directly affect residents' care and safety, that is on hold. The important thing to remember is that with the training and orientation for new staff members to come in and volunteers, again, there's training that is required that specifically impacts one's ability to provide safe care with residents, but there's a lot of other subsidiary, more secondary training that is listed in the Long-Term Care Homes Act as mandatory, but does not significantly impact the immediate care needs of residents. So that is allowed to be postponed if need be. So it's not a let's open the doors and let anyone in. It's a very controlled situation still. And I mean, we're talking about a directive that was put in place on March 23rd, and it's still the case. So the next slide talks about staffing in addition to the first one. On April 15th, the cabinet passed an emergency order that stated that healthcare workers can only work in one site. So this became in effect on April 22nd, and long-term care home employers must ensure that all employees work at only one home. And so this has been in place for a number of weeks now. And this is looking forward. I just wanted to interject that looking forward into the new norm of long-term care, this is something that we will absolutely advocate for, as we will not turn back. We will not go back to long-term care the way it was pre-COVID-19. This issue in and of itself is critical, that PSWs and other very core significant team members be provided full-time work in one home with benefits, so that they are not working in 2, 3, 4, even 5 sites just to make ends meet. So this is one change that we will push forward for in our new normal.
And I'm just keeping an eye on the chat, and we're hearing that the importance of those essential family care partners or caregivers versus casual visitors, and that's something else that FCO and OARC are emphasizing with government, as well as the fact that for many years, family caregivers have supplemented staffing levels within long-term care. And so this is something that we are bringing up regularly so that government doesn't forget this, not that they have, but so that they never do, and looking at the next phase of this normal, of this new normal, and how to embed family caregivers in that once again. So your voices have been heard. We are working regularly with government to ensure that this gets brought to their attention and acted on. Another issue that we are keeping a close eye on is around discharge of residents. And during the pandemic, no more of any off-site visits or those weekends back in the community or the home. There's no more of the 21-day leaves of absence and so on. So what that means is now, if you want to take your resident home, or the resident wishes to go back to a community home, it's for the duration of when that home is in outbreak. So when they're experiencing the consequences of the pandemic. So resident would be discharged, and they can't return to the home until that home is no longer in outbreak. It's an emotionally charged decision, and it needs to be a thoughtful and informed decision. So we collaborated with a number of organizations to create a checklist for family members and residents to consider, to work through, if they're thinking about having the residents leave the long-term care home. And so they are these discharge checklists or tools. And so there's one that we worked with the National Initiative for the Care of the Elderly and CanAge to stay or to go. The National Institute on Aging and other partners came up with their own resource as well. And so we're not going to advocate one way or the other about what you should do. But if this is something you're considering, these are tools that will help you make a well-informed decision. And moving on to this essential question of communication.
So directive number 3, and I apologize for the delay because I was just at this moment refreshing my memory of directive number 3. Communication. We have heard loud and clear that communication is a real challenge. Now I can speak from a resident perspective. Many homes seem to be doing better, not perfect, but better communicating with families and staff, and residents have reported to us at OARC that they are often left out of the loop. So because they're living, many residents in isolation, many residents being cohorted to a different part of the home, really unaware of what's going on outside of their door. But the directive from government states that long-term care homes must keep staff, families, and residents informed of the COVID-19 situation in the home. So there has been a tool designed, both FCO and OARC developed respective tools to help, and we will have a look at those.
So communication is the foundation of really any relationship, any interaction with any government or community system. And we know that some homes, many homes, are communicating very well with families, but others aren't. So we created checklists to help homes identify what information to share from families. So this is an example of one of the tools FCO developed. It's the Quick 10 COVID-19 Home Update Checklist. So it's something that a home can use to just go down the list and identify the answers to these questions or to these statements, and then just report that information. So we will have the links available for those checklists and follow-up materials, and they're on our website, but it's something that you can use, share with your home to make it easy to identify the information families need. And this was based on our ongoing work with families, identifying what they wanted to know. OARC has a similar tool.
Yes, indeed. So this tool came out of some feedback from residents as to what information they needed from their homes. And so it's divided into 4 different sections. And really it's about what is the current status in our home? How are you keeping me safe? And more importantly, not more importantly, but equally as important, how can I stay connected to the people I love? So it's a customizable template. It has gone out to all of the homes. It has also been put out, for lack of a better term, through OLTCA and Advantage Ontario. We have spoken with the ministry about this tool, and they have supported it as well. So it's a tool that is provided to residents, either verbally or in hard copy, that keeps them informed about the situation of COVID-19 and how they can expect to be well taken care of. Go ahead, Sam.
Okay, so both FCO and OARC are doing regular updates through our e-bulletins. And we increased our communication frequency to meet the needs of families, residents, and home staff to keep everyone informed. So you can see what they look like. We've also been doing joint bulletins to share the perspectives that are in common between families and residents. So we hope that you're aware of the directives that we mentioned, because homes are required to keep families, residents, and staff updated. And we've got a lot of really great feedback around it, including from the Assistant Deputy Minister, Long-Term Care Operations, who you can see the quote from him, Brian Pollard, here, that they sincerely appreciate the supportive communications that we have been putting out to assist in keeping residents safe. If you're not familiar with our bulletins, let us know and we'll help you identify how to sign up for those. And we also strongly encourage home staff and management to sign up for these as well, because as someone has pointed out, management in the home is critical to the success and how they communicate with families. So please engage with us here, stay updated on what we're doing, and keep in touch, because we do know that communication is essential. And now we want to hear another bit of feedback from you. Are you satisfied with the communication that your long-term care home has been providing you regarding COVID-19? So I'm going to ask you to, just a sec. Oh, no, it didn't quite work on me, but so what I'm going to ask is just in the chat box, are you happy with the communication your home's been providing? You can just type in your answer, yes, no, somewhat, and I will keep an eye on those. So many people are saying yes, so a few of those, quite a few somewhats, and unfortunately a couple not at alls coming in there. We're hearing feedback around, it's good, but it can be better. So more transparency. That's something that we've been pushing with homes as well, is to be transparent. Tell people what's going on, because then they're going to feel more connected, and comfortable. So a lot of somewhats, some no's as well. So it does seem, and this, your feedback reflects what we've been hearing from others as well, is that some homes are doing really well, some aren't. So we encourage you through your work as resident and family council to share with your home that there are tools that they can use that will make things simple for them and that is going to respond well to what families and residents need to know. And we also want people to be aware of what's going well and what progress is being made on things, and just what progress is being made. Testing is another key issue. Long-term care is prioritized in the province for that. At this point, residents have all been tested. Long-term care staff are going to continue to be tested at reasonable intervals. The directive is a minimum of twice in the month of June. And that is going along with active screening of all resident staff and essential visitors. So it's looking at what are the best practices from a public health and infection control standpoint. And now we are moving to more frequent testing. And then, as Dee had also mentioned, it's all about togetherness. So Dee, take it away.
Thank you. The last section of our time today before we have a Q&A is this, how we have harnessed collaborative relationships to find solutions and support each other. We see it all around us. I noted the other day, even on TV commercials, from our government, from our friends and families and colleagues, we are in this together. We will get through this together. There is no one exempt from this, and as physical distancing drives us apart physically, we believe, we hope, coming together in new and creative ways to support one another through this. Sam and I have shared a couple of resources that have produced this, all hands on deck, sense, working with each other, working with other stakeholders, at the long-term care home level, incredible examples of people rising to the challenge and working together. So if there's anything at all that this COVID-19 tragedy and crisis has brought to the forefront is the need for all of us who support and work and live and visit in long-term care homes to come together. We have many bright light ideas.
So here's a few that we've heard of. So we, as the minister also mentioned, around homes getting support from hospitals to help with infection prevention and control. So that's something that's been happening across the province to increase the capacity of those homes. We also see a resident engaging in the use of technology to stay in touch with their loved ones. This is an example from a couple from the Niagara region, and we have more as well that are about saying thank you. So family councils engaging in celebrations outside on home grounds or doing drive-by thank you parties, things like that. Things where it really is showing thank you and appreciation. There's also other people engaged in the long-term care sector who have stepped up to provide some more love and support to long-term care. Like this recreation therapy professor who did a letter writing campaign in her community and got kids and neighbors to write thank you cards and letters and so on and give them to the home to have some connection to the home staff. I'm seeing in the chat box that people are doing, the Legion did a car rally with over 400 cars in Pickering. That's another wonderful thing, and something we're also looking at in terms of supporting next steps is how do we do even more of this and get families back into homes. And then there are other ideas as well.
If you would like to have a look at a beautiful resource to support your own and resident psychosocial and emotional well-being. I encourage you to have a look at Java Group Programs website here. This is a 12-minute in-service of sorts to help to create calm and relaxing and invigorating one-to-one times together as visiting is eventually reopened in long-term care homes in a safe, systematic, tiered way. This might be a helpful resource to you. And the others are self-explanatory, so we'll continue to this one.
So there's been a lot of donations of personal protective equipment. You may have been on a session with us weeks before with Julian MERRILEE, who was able to obtain a large donation from Huawei. So it's one example of mobilizing change. Others have, universities and malls have donated trays to long-term care homes to assist with room service for residents. Others have pitched in to help mobilize window visits. So we know it's a really, really difficult time for everyone, but there are examples of success. There are ways that we can work together to mobilize change and to say thank you. Someone on the line said they got a donation of a tablet from TELUS. So there are ways that as long-term care community members, we can work together to create change. We know it is possible, and we know that there is hope. There's collaboration and creativity. There is heartfelt connection between people. People are returning back to the basic needs of emotional connection. We are having really honest conversations about human resource solutions and the challenges in long-term care. We're also raising the profile of long-term care, raising not only discussions about those challenges, but what it can be like in the future, because we're not going back to the old normal. The old normal is what caused this. We are working for something new, something better, a richer, more beautiful experience in long-term care. We're also looking at, maintaining those simple pleasures about human connection, about just those small moments of love and change, talking about the importance of teamwork and the importance and the essential role that families play as a member of the long-term care team. So we are continuing to have conversations around how to get families back into long-term care homes in safe ways and recognizing the essential role that families play in the care and well-being of their loved one. So that is something that we are working on, and we are continuing to push for that to be done, because our commitment to you is lasting change. Our commitment to you, OARC and FCO, is that we go on to something better, that long-term care becomes a vibrant, beautiful place to live and work and visit. And now, Dee, any last comments before we go into the Q&A?
Thank you, Sam. I have felt somewhat distracted during this last hour, and it's really been in response to reading the comments in the chat box. Thank you for your candidness, your transparency, your heartbreak. It is palpable. And you have our commitment, as Sam has said, to work with government and stakeholders to insist that on your behalf and on the behalf of every single resident in long-term care, that things will be changed. What is most frustrating, I think, or what is super frustrating, is the inconsistency across the board. Some homes are following advice, some homes are not. Some homes are permitting care packages to come into the homes for residents, some are not. Some are permitting essential visitors as defined in Directive number 3, which includes family or volunteers providing care services or other healthcare services. Some homes are permitting that, some homes are not. It is quite frustrating for you. We hear you. We are, again, I can only reiterate our commitment to be the voice for residents and families with government. Nothing is more important to us than ensuring safety and reunification of families with residents so that the psychosocial and emotional well-being of everyone is restored. Because what's going to happen is at the end of this immediate crisis is we will be left with residents who may have physically survived and family members who have physically survived, but whose spirits have been broken. And that is of paramount critical importance to us respectively within our organizations. Over to you, Sam.
So yes, I've been looking through the chat box as well and trying to really take the pulse of what we're talking about. And just to add to that, just to respond to Kathleen's question about details of the plan to visit loved ones again, we are working on that. We've had pretty much weekly or twice a week calls with the Ministry of Long-Term Care to discuss next steps, because pretty much as soon as their visitor restriction came out, we were saying, okay, and then what? What's the plan for the next step in this? Because if this pandemic lasts for 12 to 18 months, we can't close off long-term care homes to families for that long. It's inhumane. So since the change was put into place, we've been then asking, okay, what next? So we're hopeful that a plan will be released in the coming week or so, because time is precious. As Kathleen's saying, precious time is moving on. So we, as OARC and FCO, each did a consultation process with our folks. FCO got well over 100 responses and ideas, so we analyzed that information and proposed it to government. So that is something that we are working on, so that you can get back into your long-term care homes. And so we are also looking at, reading the chat as well, grief counseling is something that we're also working with our partners to identify mental health supports. So that's something that's working on as well. The Ontario Caregiver Organization is doing some work on that. We are here seeing also a lot in the chat about accessing technology around personal protective equipment and so on. I'm going to do a final call for questions. And so I'd say right now, type your questions into the chat box, and also give us suggestions on what sort of sessions you want to see next. Because we are running several more sessions over the course of the couple of weeks, but we're also planning for what comes next. So send us your questions, your comments, and your ideas in the chat box, and then we are going to wrap up this afternoon's session. All right, so I've seen one fantastic question coming in from comment coming in from Donna around recruiting PSWs by having full-time jobs, good benefits, and a respectable pay salary. We couldn't agree more. In order for people to do their best work, they need to be adequately compensated. And the minister had mentioned the HR work being done. FCO was at that table talking about the needs of PSWs. And as you also pointed out, PSW work is largely being done by women of color, immigrant women, and who often don't have a voice. And that we don't have enough PSWs in normal time, never mind during a crisis, and this does need to change. So that is something that we have said for quite some time, is that PSWs need to be paid well, respected, and be seen as the vital members of the team that they are. And we need to take an intersectional lens where we look at the impacts of race, racialization, gender, and so on in this work. So we are continuing to do that. Looking at a question from Nicole about communicating with nursing staff by email to reduce time and plan time more effectively. I couldn't appreciate that question more. So we have our Quick 10 checklist that's for the home to use in communicating with you. We also have a companion document that families can use to gather your thoughts. So it's another Quick 10 checklist of things you might want to ask of home staff. So I'd say look at that because that can help you gather your thoughts. We're also providing feedback to a project being done by the Centers for Learning, Research, and Innovation in Long-Term Care, known as the CLRIs. They have an effective communication for families tool that's going to be coming out in the next week or so. And it's going to teach families how to use a particular framework to more effectively communicate concerns, observations, and what you'd like to see done. So those are a couple of tools that can really help you gather your thoughts so that you can make the best time out of the communications that you have with the nursing staff, both by phone and by email. So take a look at those. That's all that's in our website. And when the CLRI tool is available, then we will make sure that, that you know about it so that you can support yourselves and your peers as caregivers. I'm seeing another one about needing homes to keep families updated with health changes. That's also really another important, essential piece of communication, and that's why we developed the Quick 10 checklist so that nurses and other home staff can quickly gather the information that families need to know. So please share our resources with the home staff to encourage them to use the materials that have been developed to make it easy for them to communicate with you in a way that meets your needs. Okay. So in wrapping up, I also want to remind you, this is just the first session of many that we have planned over the next several weeks. Tomorrow, we're going to be having the Patient Ombudsman's Office speak about their work and how, and also give you an update on their investigation so that you can understand how to best engage with that work to make your voice heard. On Thursday, we have a session called Change Starts Within, and that's going to be geared to more towards a self-care approach. So to understand how to really lead, a good, healthy, positive life, looking at the science of positive psychology. And then again, next week we are running our Family Council forums, and those are the more informal, peer support-based sessions that will provide you with an opportunity to connect with each other and come up with ideas, suggestions, recommendations that really help you apply what you're learning with us and what you're hearing out from the media. As well, next week is Reimagining Long-Term Care webinar that's going to be based on the work that's been done across Canada. And actually internationally, looking at reimagining long-term residential care, an international study of promising practices. So that's another one that you don't want to miss. And then we're also going to be having other sessions that help you be informed. So telephone scams and internet scams are on the rise right now during COVID-19. So join us for a session on how to keep yourself safe. And so stay tuned, check out our daily e-bulletins for more information on those sessions. I'm going to say a final thank you to everyone who attended, and thank you for your patience in figuring out our tech issues and being with us as we try using a tool in a new way. So happy Family Council Week. Thank you for joining us this afternoon. If you have any questions after this is over, please get in touch and we'll make sure that you have a copy of the slide deck. So thank you, take care, and have a great rest of your day.